So let's start with what is a stroke? Well, stroke is related to impaired blood flow or bleeding into the brain that causes a very localized tissue injury. Depending on where that tissue injury is, you may end up having either paralysis on one side of the body, loss of vision off to one side of your world, perhaps loss of word finding or ability to express speech. You may have trouble with swallowing. You may have trouble with sensation and even knowing where your limbs are in space. These are problems that pose tremendous disability to our patients. And yet the hopeful side of this is that we can improve our function after a stroke by any number of ways that I'm going to tell you about. Let me show you what a stroke looks like. This is a slice of a brain in plastic, a real brain. Brain weighs about 3 pounds. This slice is a very thin slice of the very larger brain. And it's cut from the front to the back. So this is the front of the brain, this is the back of the brain. These are the ventricles of the brain, and these are the tissues of the brain. This is the cortex, this is the white matter. This is a picture then, a slice of the brain taken coronally. So now we're looking straight on at the brain to best bring out these ventricles here. And here you see that there's a very large area of tissue damage. It's an old slice, but it gives you the sense of how devastating this whole side of the brain is. And that led to profound paralysis, loss of speech, and made this person have great difficulty in walking and taking care of himself. Another kind of stroke would be a hemorrhage. And again, compared to the normal brain here, what we see is this reddish, brownish blood that leaked from deep in the brain, an area called the thalamus and capsule, and then bled actually into those spinal fluid spaces, causing profound impairment. So about 10 to 15% of strokes are related to hemorrhage. About a third to half of strokes are related to very large strokes that affect one side of the brain. And then there are other kinds of strokes that are very small holes that can cause a lot of weakness or difficulties, not because they're big, but because they occur in a very important, eloquent area of the brain that controls movement or sensation. Let's say you had a stroke a week ago or even a year ago. What do you want to know to best understand how you can get better? What's your potential for improving? But first, let's talk about what you want to do to prevent a next stroke. So it's very important to look for risk factors that might produce yet another stroke or even a heart attack. Those are the factors like abnormal lipids, persistence of high blood pressure, heart disease that causes an irregular rhythm, such as atrial fibrillation that allows clot to form in the heart chambers. Of course, cigarette smoking and diabetes. All of these can have profound effects on making you susceptible to a second stroke. And indeed, people have somewhere between a 5 and 8% per year after having a first stroke of having a second one. So you want to know for sure what caused the first stroke, working with your doctor towards that end, and do as much risk factor management as possible to prevent that second stroke. You're probably taking new medications. Those new medications can have good effects in maintaining your blood sugar, your blood pressure in a good range. They can also have some negative impact. They might make you feel a little bit drowsy. Your blood pressure could get too low when you stand up and lead to difficulties with concentration and thinking. Your blood sugar could get too low if it's overtreated. And then there are certain drugs that can affect muscle strength or produce fatigue. For example, some of the cholesterol-lowering drugs, the statins, can lead to a myopathy and lead to difficulty standing up or walking because they cause weakness in your hips and thigh muscles. So if you notice that, you want to talk to your physician about it. And one last thing, depression is very common after stroke. About 50% of people may become depressed. You've got to talk to your spouse, your family, and your physician about this if you're feeling blue, because there are good treatments for it. If you've had a stroke and you're just a couple of weeks out, there are a few rules of thumb. First of all, you're still in a position where you can get much, much better over time. The initial first few months is probably the period of most rapid gains in the things that are most noticeable for you, such as recovering use of a hand and arm, or catching up in being able to say the words you want to use, or being able to help yourself walking. A few things, though, suggest difficulties ahead. For example, at the end of about 3 or 4 weeks, if you're unable to extend your wrists or open your fingers, the chances are that you're not going to have a highly functional hand again. Hand function requires a lot of brain tissue, and to be able to do fine movements, to be able to pinch, to be able to grasp and release, takes a lot of cortical and subcortical tissue that has to be intact. So the prognosis is not so good by the end of a month or so if you're not able to do a little bit of that kind of movement. On the other hand, if you can make any kind of little bit of wrist extension or finger opening, there's a good chance that over months and months you'll be able to continue to improve in that recovery, because there's still some residual spare tissue there, and you're going to now train it to do a better job. For walking, if you're able to even flex a little bit at the hip and extend even a little bit of your knee to be able to stand on it, the chances are you will be able to recover walking. For language problems, some people start out with maybe just trouble with word finding, or maybe trouble with comprehending what other people say, or maybe they can't either comprehend or express themselves. Well, this kind of recovery the degree of recovery is going to be uncertain for many, many months, and even out to 6 months, a year. We find that people continue to improve if they practice trying to find words, if they keep working to enhance their recovery of function. So in a sense, it's possible that there's never a time when you've improved as much as you can. In other words, many times the physicians just don't know enough to be too pessimistic about your ability to recover. And so you have to be the person who drives that recovery, you and those who are around you. Inpatient rehabilitation therapy is for the first couple of weeks, maybe 3 or 4 weeks at most, after that acute stroke that has made you so disabled that you're not able to immediately go home. During this time, the therapist is going to work with you to be able to get you well enough, functional enough to be manageable at home. It means learning how to move from a bed into a chair. It means learning how to come to a stand on a very weak or perhaps insensate leg. It means gradually beginning to take some steps with a therapist trying to cue you to be able to allow you to flex your hip, to swing your leg, and load your leg so that the knee doesn't buckle. Once you've achieved the ability to walk short distances and begin to help take care of yourself, and your family has learned how to help you, in a sense has been trained to assist you and reduce that burden of care, the next step is your outpatient therapy. This may be done at home, it may be done in a clinic setting. The goal there is to try to maximize over the next few months your ability to use that affected upper extremity, to be able to walk at faster speeds, more safely, with less energy cost for that stepping, walk longer distances. And if you have an aphasia, problems with expression or comprehension of language, then that's a time when the speech therapist is going to be continuing to work with you both during therapy and have your family work with you to try to enhance your language skills and your communicative skills. A lot of studies suggest that you do plateau in terms of gross recovery of function at the end of about 3 or 4 months. But there's still plenty of time to improve finer elements of movement that will enhance the quality of your life. So those are the things that I want to emphasize. These are the things where, these are the goals that you're going to set. You're going to set feasible goals that allow you to optimize your skills over the subsequent years.